Okay, let's dive right into this. We're going to be looking at a really powerful story, and it comes straight from the personal blog of a man named Rick. He's sharing his journey with advanced prostate cancer, and he's doing it in his own words.
So, right off the bat, Rick lays it all out. I have advanced level 4 cancer that has metastasized into my bones and lymph nodes. I need a doctor. Wow. That's the urgent reality for him, living in Woodstock, New Brunswick. And these words, they really set the stage for a story that's about so much more than just a medical diagnosis. It's about a fight on, well, multiple fronts.
So here's the plan. We're going to walk through Rick's journey, really see it from his perspective. He's been living with advanced prostate cancer for over 19 months, and he's been writing about it the whole time.
First things first, what does the day-to-day fight actually look like for him? Let's talk about life on chemotherapy. Okay, so the cornerstone of Rick's treatment is something called ADT. That stands for androgen deprivation therapy. Think of it like this. It's a treatment designed to basically starve the cancer by cutting off the hormones that help it grow. It's a really key part of the fight for patients with this type of prostate cancer.
But here's the thing. Rick isn't just on the standard ADT. No, he's on what he calls an aggressive tritherapy. It's a three-pronged attack. You've got Lupron Depot, a chemo drug called docetaxel, and another one, darolutamide. So they're really hitting this hard. And the goal of all this? Well, it's pretty straightforward. Slow the spread and kill the cancer. But there's a harsh reality here, and Rick knows this from all the research he's done. It's often a race against the clock. Most patients, after about 2 or 3 years, start to develop a resistance to the treatment. The clock is ticking. And this really brings home the human side of it all. The battle isn't just physical. It has these huge personal costs. He talks about one day, April 27th, which he calls broken dreams. 10 volunteers, all smiling and ready to help, showed up to clear out his woodworking shops, places he loved but just couldn't manage anymore. Just imagine that. So, as if fighting cancer wasn't enough, Rick finds himself in another battle. This one is with the healthcare system itself, which he feels is failing him when he needs it most. And this is where his story really opens up into something much bigger. Just listen to this. He gets a phone call late in the week from his doctor's office. The news? His doctor is retiring, effective immediately. So he asks the obvious question, who's taking over for her? The answer he gets is just unbelievable. No one. He pleads with them. I need a doctor. It is critical. And the response? You will get a letter in the mail. Can you even imagine hearing that? Now, you might think, wow, that's just terrible luck. But it turns out Rick's situation is far from unique. In 2022, in his province of New Brunswick alone, over 74,000 people were without a family doctor. 74,000. That's a huge number. It really shows that his personal struggle is part of a much, much bigger problem. And this all points to a massive system-wide issue, right? Because even if you do have a doctor, you could be waiting weeks just to see them. Now, nurse practitioners are a huge help, for sure. But as Rick points out, there are limits to the kinds of tests they can order. For someone with complex needs like him, that's just another roadblock. But here's what's so amazing about Rick. He's not just sitting back and accepting this. No way. He's decided to turn his personal fight into a public call for awareness, for action. And his blog? That's his megaphone. So what exactly is he trying to tell us? He's using his platform to share what he believes is life-saving information. So what does Rick want you to know? His key messages are super clear and practical. First, get a simple PSA blood test for early detection. Second, he's saying men should think about getting tested starting at age 40, not waiting until 50 or older. He also wants people to support awareness campaigns, like Light Up in Blue in September. And then there's this really interesting one. Don't just look for medical research in North America. Broaden your horizons. And that really gets to the heart of Rick's mission, doesn't it? He's determined to use his voice, no matter how hard it is, to fight for change. And you can really see his dedication. He actually writes about debating with himself about the best way to get his story out there. Should he stick to writing these long blog posts, or should he try to learn video editing? He's asking himself, what do I know about video editing? Nothing. And who really wants to watch a video of me talking? It's just this raw, honest look at his relentless drive to get the message out, whatever it takes. So, in the end, Rick's story is just this incredible example of one person's resilience, not just against a terrible disease, but against a system that's under so much strain. And it leaves us with this really important question to think about.
Rick is using his voice to fight for change. But how many other people are out there fighting the exact same battles, but they're doing it in silence?